About the coding. First, you know about what is coding. Coding is the processing of assigning number to disease and procedure terms. What do you mean disease? What do you mean procedure? Because disease means all the patient's disease condition and everything they wanted to evaluate. Procedure, what they are doing and everything we wanted to know about the procedures, course and everything. The code number, each disease and operation are recorded on the face sheet. First, you know about what is face sheet. Face sheet is the admission and discharge record. This admission and discharge record divided into three parts. First part and second part and third part. Upper part is only for the socio-economic data. The socio-economic data such as name of the patient, then address, telephone number, kith and kin address and everything, all the details and everything you wanted to record about the face sheet in the first part. And second part only for the doctors, they wanted to know about the disease condition and everything. Professional and final diagnosis, they wanted to enter into the face sheet. After recording the face sheet, after that the coding process will be due in the medical record department. First, you wanted to about the what is the classification of disease. The classification and operation is the one of the most important functions in the medical record department. A well organized medical record department select one of the best situation international classification of disease, morbidity and mortality. What do you mean morbidity? Morbidity is the disease condition. Mortality is the death condition of the patients and everything. Why we need to code? Coding is done in order to group of condition and procedure that are similar for statistical tabulation, because all the codes you wanted to know about the statistical tabulation. This one you wanted to plan the appropriate health services, classify the patterns of disease and the healthcare facilities to evaluate the healthcare, because they wanted to evaluate the patient's care and everything. You wanted to collect all the details of the ICD course, because everything you wanted to analyze. Then you wanted to analyze, you wanted to interpret, you wanted to then evaluate the patient's care and everything. What is ICD-10? The ICD-10 stands for International Classification of Disease according to ICD-10. The ICD-10 design three categories. One is structure, another one is chapter, another one is code. Structure is the 3 volume and the chapter is 22 chapter and the code is alphanumeric code. The first one volume is 3 volumes. Volume 1 and Volume 2 and Volume 3. Volume 1 is the tabular list and Volume 2 is the guidelines and Volume 3 is the alphanumerical code. If you are the coder, what is the responsibility for you? First, you wanted to assign the right code with the required character, because all the disease and everything, first you analyze the final diagnosis good or not. If they're not available in the final diagnosis, immediately you call the doctor to inform the final diagnosis and the professional diagnosis. After that, you wanted to assign the code number. What is the basic knowledge of learning coding? Because first you wanted to know about human anatomy and physiology. What do you mean human anatomy? Human anatomy is the structure of the body and physiology is the functions of the body. Then you wanted to learn about the medical terminology. What do you mean medical? How to analyze the medical terminology? Terminology means, term means word, logy means study. Study of the medical words. Spell the words, vocabulary the words and everything. Understand the medical word, understand the English and everything you wanted to know about. This one, the pharmacological and biochemistry, because the knowledge of various lab investigation, that normal value and everything you wanted to learn about the coding. These are all the basic learning for the coding for you. Next one, you wanted to learn about the English knowledge. That English knowledge, why you want to read and understand, how to read, how to understand, how to pronounce. These are all will be implemented the coding. What is the principal diagnosis and the final diagnosis? Principal diagnosis at the time of admission, that is called principal diagnosis. At the time of discharge, the termination of the patients in the hospital, that is called final diagnosis. condition established after study to be responsible for occasional admission of a patient to the hospital for care. Next one, the principal diagnosis is not necessarily the symptoms presented by the patient admission. Diagnosis determined by the doctor. At the time of admission, the principal diagnosis will be evaluated. After termination of the hospital, that is called final diagnosis. Then, what are the volume ICD-10? Volume ICD-10, volume 1 is the tabular list. This tabular list consists of 3 character categories. What do you mean 3 character categories? Example, if you want to take all the code numbers and everything, A00 is the 3 character categories. After decimal points and everything, that is the behavior code and everything you wanted to listed the 4th character categories and everything. What is morphology and neoplasm? Morphology is the tissue culture and the study of the tissue and everything. The morphology code, example, squamous cell carcinoma 8070/3. 8070 is the morphology, that is the disease and everything. After that slash, third 0, 1, 3 and 6 and 9. 0 is the benign cases. 1 is the uncertain behavior. 2 is the in situ cases. 3 is the malignancy. 6 is the metastasis. 9 is the unknown primary and everything. These are all the morphology code and neoplasm, oncology code and everything. According to morphology, that is the topography and morphology. Topography is the disease site and everything. Morphology is the disease evaluation and everything. Then special tabulation of morbidity and mortality. It is the volume 1 is the British spelling is used. Then volume 2. What do you mean volume 2? Volume 2 is the guidelines. It is the instructional manual and guidelines. It is the description how to use ICD-10, volume 1 and volume 2 and volume 3. These are all used to the guidelines. The rules and guidelines for mortality code with cause of death. Because what do you mean cause of death? Cause of death, underlying cause. Because the patient admitted in fever or something, at the time of death, what is the patient condition and everything they wanted to evaluate, what is the cause of the death and everything. At the time of death only you want to analyze the cause. Then rules or guidelines for morbidity coding. What is the rules? What is the guidelines? How to prepare? These are all the guidelines will be analyzed. Then statistical presentation. Then history and development of ICD. How to develop the ICD and everything. Then ICD is the International Classification of Disease published by WHO. The ICD-10 implemented in 1994 and it is the 3 volumes. Then volume 3 is the alpha index. Alpha index is the introduction. Then alpha index of disease and natural injuries and the external cause of injuries. What do you mean external cause? Because this is any accident, any poison or some other cases, that is the external cause. This external cause will be analyzed, that is the activity code and place of occurrence, where it will happen, what is doing at the time of happen and everything. These are all analyzed the cause of external cause of disease and injuries. Then table of drugs and chemicals. What are the drugs they wanted to use? What are the chemicals and everything you wanted to analyze? Because what do you mean CPT? CPT is the procedural terminology. This is only for the billing purpose only we are using the CPT. It is the comprehensive listing of medical terminology and codes for uniform designation of diagnostic and therapeutic procedure. What is the purpose? To provide the standard terminology and coding for considered. That is the universal coding and everything. That is CPT is the current procedural terminology. Just current procedural terminology using for the universal wise. This one explain what is the conventional table. Conventional table will be used to exclusion term, inclusion term, then bracket, then dual coding system and glossary description, then everything wanted to analyze. What do you mean inclusion term? Within the 3 and 4 character rubrics, there are usually listed the number of diagnoses, that is called inclusion term. Exclusion term, certain Dewberry condition listed of condition preceded by the word excluded, that the term is excluded, that is called exclusion term. Glossary description, that is the mental and behavior disorder and used to the glossary description. Dual coding system, dagger and asterisk. Dual coding system, 2 code number you wanted to analyze, that is the dagger and asterisk. Dagger is the primary code, asterisk is the secondary code. Because the dual coding system, the primary code underlying the disease is marked with the dagger and optional code for the manifestation marked with asterisk. Asterisk code can be never be used alone, but that is primary code used alone everything. This is ICD 10. There are 83 asterisk categories and primary code is for the underlying disease and is marked with the dagger and asterisk code, must be used alone. This one parenthesis. What do you mean parenthesis? That is the bracket. It is usually for the 4 ways in the volumes and everything. That is includes supplementary words which follows the code numbers and everything. This is the parenthesis. Then NOS and NEC. What do you mean NOS? Not otherwise classified, not elsewhere classified. Not otherwise classified, it is implying unspecified or unqualified code. Should be careful not to be code and term unqualified and unless it is clear that no information is available. NEC not elsewhere classified. It is the 3 character categories titled with the NEC, not elsewhere classified. And is the title. What do you mean and? ICD 10 and stand for unspecified injury of shoulder of upper arm, that is called, we are using and. Then point dash, when it is used to replacement for 4 character subcategories. What do you mean 4 character? Because A00.3, that is after decimal, that is the 4 character categories. That is the behavior code. You analyze the behavior code and everything. What is underlying cause of death? Death certificates are main source of the mortality data. Because all the death certificate, patient death, after that they wanted to produce the death certificate. This death certificate are main source of mortality data. The death certificate may be provided by doctors in the case of accident or viral death or some other death. These are all issued by the doctors only. The person certifying the cause of death will enter the sequence of events leading to the death on death certificate. Many death certificates give only single cause of death. However, 2 or more conditions must be recorded on the certificate because name of disease, their age, place of death and everything they wanted to analyze. What do you mean underlying cause? Because the patient admitted fever or headache or something at the 3 days or 4 days after treatment, the patient expired. What is the patient cause? At the time of expired, what is the patient cause? Any sudden heart attack or some other things. These are all the cause of death and everything. Then you wanted to analyze what do you mean by sequelae. Sequelae is the past condition represented to present condition, that is called sequelae. Sequelae is the late effect of certain condition. A number of categories are available which enable to coding of past condition as caused the present condition. This is called sequelae. What are the basic guidelines for coding? First, you identify the type of statement to be coded, refer to the appropriate sections of alphanumeric index. First, you wanted to analyze alphanumeric index. Any diseases or something, first you wanted to analyze the alphanumeric index. Then locate the lead term, locate the code number and everything for the disease and injuries. This is usually known the pathological condition. Read and guide any more and appears. The follow carefully and cross the reference found any indexes or something. Refer to the tabular list to verify the situated code and everything. To assign the code numbers. How to identify the OBC code and everything? That is the gravidia and everything you wanted to analyze, because this admission, post-ups admission and the everything, two types of admissions are there in cesarean admission. One is called, that is the emergency admission, and these are all, the cesarean section admission, two types. One is elective admission, another one is emergency admission. Because this indication and everything, the type of delivery, then high risk delivery and everything you wanted to analyze. The ICD procedure and legal matters. What do you mean ICD procedure and legal matter? ICD is the Global Health Information Standard for mortality and morbidity statistics. Because all the ICD you wanted to analyze mortality and morbidity. Morbidity is the disease condition, mortality is the death condition of the patients and everything. ICD has been translated into 43 languages. ICD helps the monitor death and disease rates. Primary use, doctors, nurses and other paramedical workers. ICD is the creation of 1948 and published the 6th revision. 6th revision, 7th revision, 8th revision, 9th revision, 10th revision. Now we wanted to implement the 11th revision also, because the ICD-10 published in the year 1993. What is the difference between ICD-9 and ICD-10? ICD-9 is that is two volumes are there. Volume 1 is the tabular list and volume 2 is the numerical code. ICD-10 is the 3 volume. Volume 1 and volume 2 and volume 3. Volume 1 is the tabular list, volume 2 is the guidelines and volume 3 is the alphanumeric code. Because these all external cause of injuries and everything wanted to analyze in ICD-9 E code. If you wanted to put it to the E code only, external cause of injuries. Because in ICD-10 S code, S, T, U, V, W, like this, all the things and everything you wanted to analyze in ICD-10. Then ICD-9 is the 17th chapter is available. In ICD-10, 22 chapter is available. Because in the ICD-9 and ICD-10, what is the difference? It is design, ICD-10 design 3: structure, characters and the code. Structure is the volume 3, code is the alphanumeric code and the chapter is 22 chapter. In ICD-9, external cause of injury and everything, we wanted to analyze the E code and everything. Then ICD-9, International Classification of Disease, Injuries and Operation and Cause of Death and everything. In ICD-10, introduced in 1992 but implemented in the 1994. Because this ICD procedure and everything, coding and data abstracting the purpose to correctly and accurately assign the standard of disease and operation and procedure code to all discharged inpatients' medical record and enter the data on computer for future reference for policy. Because all the discharged patients and everything we wanted to analyze, first assemble the files and everything, that is according to the WHO rules and regulation to analyze the records and everything. After that you assign the numbers and everything. It is the policy of medical record department to code all inpatient discharges and everything. Then receive the medical records from the medical record technician who have analyzed the file for completeness. Discharge inpatient medical record will be coded daily against the discharge census at the end of each month. The medical record technician will refer to the list of the discharges for all the files they are not yet coded. Review of the medical record inpatient admission sheet, discharge summary, history and physical examination, everything you wanted to analyze. You want to assemble the files according to the WHO, World Health Organization, orders and everything. Then you wanted to entered into the computer, all the diagnosis, all the procedure, all the codes will be entered into the computer. Then the physical and progress report plus operative and pathological reports, and ascertain there are no discrepancies information. If there is, ask the first physician for clarification of the diagnosis before putting the code. Determine that primary and final diagnosis has been listed first and any secondary code are listed in the correct coding sequence. Because all the codes are identify the diagnosis, operation and procedure, listed them in under the inpatient admission sheet in correct sequence in the column marked ICD 10. Place your initial next to those of the analysis in the blank box next to the column marked ICD code number on the inpatient admission sheet. Then volume 1 tabular list all the things before you are analyzing: 3 character, 4 characters, morphology of neoplasm, list of the tabulation of morbidity and mortality related to the most widely recognized the medical classification maintained by the WHO, primary purpose categorized disease of morbidity and mortality condition. And volume 2 we already discussed about the description of how to use ICD 10, what is the rules and guidelines of mortality and morbidity coding, what is the statistical presentation, what is the history and development of coding and everything. These volume 3 alphabetical index and everything they wanted to analyze the drugs and chemicals and everything, all the disease and injury condition and everything you wanted to analyze this one. Because now you wanted the basic guidelines for coding, how to use the basic guidelines and everything for the coding and everything. First you wanted to learn about the leading terms and everything, diagnosis and everything you wanted to analyze. Because first you wanted to analyze the guidelines. For general condition, the lead term will directly identify the code number, because any diseases and everything you wanted to analyze, directly you go to the identify the code number. First volume 3, first you check the volume 3. For specified disease condition, the alphabetical index volume 3 should be referred appropriately, because any diseases and everything immediately go through the alpha index, that is the volume 3. The statement given in the tabular list volume 1 will only confirm the right code, because first you wanted to analyze the alphanumeric code volume 3, then you wanted to confirm the tabular list volume 1, that is the confirmation list, that is the correct code and everything. Then you taking the code mentioned in the alphabetical index volume 3 for granted will lead to wrong code if many conditions. Any diagnosis for coding the subjected to confirmation by going through the medical record, the laboratory reports, external causes, pregnancy, age, occupation, then pre-existing condition, etc. by applying the clinical pertinence. What do you mean clinical pertinence? That clinical pertinence is the disease and the operation code. You wanted to analyze, justify the diagnosis, justify the treatment, justify the operation and everything, that is the clinical pertinence. All malignancy condition must be supported by the pathological condition. Any malignancy, any cancer cases and everything, it will be supported only for the pathological condition. After that only you wanted to prove this is the cancer cases. Otherwise that is the benign cases. Because clinically we cannot note the malignancy. After pathological report came, at that time only you wanted to analyze, this is called malignancy cases, this is the cancer cases and everything. After that you wanted to check the neoplasm code, then what is the patient disease and everything. After that you analyze you assign the numbers and everything to appropriate coding must be reviewed. Then morphology and behavior of the neoplasm must be referred the page number 1179 to 1204 in the volume 1 coding book. Then O is the benign, 0 is the benign, 1 is the neoplasm, uncertain behavior, 2 is the in situ, 3 is the malignancy of the neoplasm, then 6 is the metastasis, and 9 is the unknown primary. What do you mean unknown primary? Unknown primary, undetected cancer and everything. The primary code and everything, they cannot undetected. After that you wanted to put it to the 9. 9 is the unknown primary. For old injury, disease condition for more than 1 year, duration from the original injury, the term sequelae. Immediately you wanted to go through the sequelae code number and everything you wanted to find out. Any that is the old condition referred to the previous normal condition and everything, because this condition more than 1 year, after that then present condition is same condition, that is called sequelae. When coding to any type of injury course or injury be site, external cause of injury, activity code and place of occurrence, what they will do, everything you wanted to analyze. For all diagnosis or ingestion of poison of drugs and everything, you wanted to check the table of drugs and chemicals and refer to the coding book. The generic name, what is the generic name of the drugs, place of reference, hospital formulary, to check all the things, and pharmacist as code are not available for the trade name of the drugs and everything you wanted to check. When the coding for diabetics related to complication, additional care should be taken in identifying, that is the IDDEM and NIDDM. But insulin dependent diabetic mellitus, non-insulin dependent diabetic mellitus categories. It will not be good to code E14, cannot give that one. That is the type 1 and type 2 diabetic. Type 1, which is the type 1 diabetic, juvenile diabetic and everything. Type 2 diabetic, what is this? Everything you wanted to put into the code numbers and everything, then according to the NIDDM and IDDDM. The extra care must be taken. Extra care must be another one. Taken while coding psychiatric condition by going through the relevant subdivision of meticulously. When coding for diabetic, do not forget to check the patient age of onset of condition, because any juvenile code and everything, that is the child and everything, is the juvenile code. Matured and pregnancy in the case of female patients. Then when coding for cataract, do not forget any cataract patients and eye defect or something, you cannot forget to check the patient's age of onset conditions such as juvenile, pre-senile and the seniles. Whenever coding the complication during pregnancy, please refer to 0999. That is, vomiting any diabetic and hypertension during the pregnancy should be meant as hyperemesis gravidum. What do you mean hyperemesis gravidum? First you analyze the code. Hyper means excessive. Emesis and gravidum means gestation. Emesis means vomiting. At the pregnancy, vomiting, gestational diabetic and pregnancy induced hypertension respectively. This rule does not apply for pre-existing diabetic or hypertension. Code for all abortion and everything then should have the additional character, but going into the medical documents correctly. A full term deliveries should be completed 30 weeks of gestation. After 30 weeks, that is the gestation and everything, deliveries and everything. After 37, 38, 39 and 40. What is the full term delivery and everything? Below 37, that is the preterm delivery and everything. Below 37, 35, 36 and 30 or something, whatever. All delivery codes should be appropriate additional code for outcome of delivery. What is the outcome of delivery? All the normal delivery and everything, you wanted to check two codes. One code is what type of delivery and the outcome of delivery. Outcome of delivery means that is the child, whether male or female, twins baby or something, whatever that code you wanted to enter into the code numbers and everything. Then infant birth weight should be traced from the record and coded appropriately with the child records, because all the codes and everything you wanted to analyze, then put it to the child code and everything. For all cesarean section, example LSCS. LSCS admission is two types of admission. One is called the elective admission, another one is called emergency admission. That indication, type of delivery, then outcome of delivery, then procedure, all the codes if you wanted to put it to the cesarean sections and everything. While the coding of myocardial infarction, please read the record and investigation reports thoroughly by the right coding. Please note that the separate code for those who hold myocardial infarction or something is there or not. Then coding is myocardial, any heart problem or something, immediately you check whether previous investigation and everything you check. After that you put it to the code numbers and everything. Then go through all the available clinical data provided in the medical record for the correct coding, the external cause of injuries. What do you mean that is external cause? The external cause of injuries and everything, you wanted to analyze the activity code and place of occurrence in the external cause, morbidity and mortality code and everything. Any poison cases, any injury cases, any accident cases and everything, first you wanted to analyze the activity code. Then place of occurrence, where it will happen, why it will happen, what he is doing at the time of happen, and everything you wanted to analyze the code numbers. These are all the code numbers. Next class you want to discuss about the coding.